Hi everyone, my name is Dalton Trujillo. My topic is soluble urokinase receptor and chronic kidney disease. Definitions: relatively high plasma levels of soluble urokinase type plasminogen activator receptor support have been associated with fecal and segmental glomerulosclerosis and poor clinical outcomes in patients with various conditions. It is unknown whether elevated support levels in patients with normal kidney functions are associated with a future decrease in estimated glomerular filtration rate (eGFR) and incident chronic kidney disease.
Chronic kidney disease, or CKD, describes the gradual loss of kidney function. The primary function of your kidneys is to filter your blood, to remove waste and water. However, over time, conditions like diabetes, high blood pressure, or even other diseases like autoimmune and congenital can damage the kidneys and weaken their ability to filter waste and water from your blood. Now, depending on the disease that is causing the kidney dysfunction, you may be diagnosed with conditions like diabetic nephropathy, polycystic kidney disease, hypertensive nephrosclerosis, and when we use the term CKD, it applies to all of these conditions. The two most common causes of chronic kidney disease are high blood pressure and diabetes, so people with these conditions are at risk for CKD. Other people at risk include those with a family history of renal disease and those who take a lot of painkillers, even over-the-counter products like ibuprofen. CKD tends to be a silent disease, and in the early stages of it, there are usually no symptoms. As the disease progresses, some symptoms may include changes to how often you need to urinate, feeling tired or drowsy, losing appetite, swelling in the feet and in the hands, a feeling of itchiness or numbness, nausea, vomiting, muscle cramps, and darkness of skin. Often, kidney diseases are discovered through routine testing of blood or urine. The major blood test that is performed to diagnose CKD is the serum creatinine, which estimates how well the kidneys are removing waste products. The serum creatinine, along with other factors such as age, race, and gender, are used to estimate the glomerular filtration rate, or GFR, which is a measure of kidney function. Unfortunately, there is no cure for CKD, but treatment is designed to delay the progression of the disease. There are some medications that can help slow down the progression of the disease, but the main interventions consist in controlling the underlying condition. People with reduced kidney function should see their doctors regularly to keep their blood sugar and blood pressure levels under control and avoid taking painkillers or smoking. Treatment options for patients with very low kidney function or in the end stages of CKD include dialysis and kidney transplantation.
Application in medicine: the intra-individual variability, the clinical and pathological variables associated with the super levels, and whether the circulating levels of the super allow to differentiate the idiopathic forms of focal and segmental glomerulosclerosis (VSG) from the secondary VSGs, regardless of the presence of nephrotic syndrome and of the activity phase.
I am Dr. Vishwanath, consultant nephrologist and HOD nephrology. I am working at Manipal Hospital, Bangalore. Unfortunately, kidney disease most often doesn't have any symptoms unless there is a significant decline in kidney function. Initially, there may be some vague symptoms like unexplained anemia, feeling weak, tiredness, which is often attributed to anemia. Many a times, anytime you find unexplained anemia, you have to go to the bottom and see if kidney is contributing or not. You have to make sure that kidney functions are okay. Generally, you will know whether kidney is contributing or not. Apart from these, when the kidney functions decline beyond 90% kidney is damaged, then only you will develop symptoms like swelling of the feet, swelling of the face, recurrent vomiting, nausea. Sometimes you can have unexplained weight loss because you don't feel like eating, you don't feel all that good, you always feel like resting, sleeping. So these are all vague symptoms. There is no specific symptom to tell this can come with kidney, unlike heart where you have some chest pain, you go to your doctor, see and get evaluated. Most often, by the time you develop symptoms and go to your doctor, there may be a significant kidney damage. That's the reason, don't wait for the symptoms to come in to check for kidney. You need to check for the kidney even before the symptoms arrive, because by the time symptoms set in and you start detecting kidney problem, it may be a very late stage.
Pros and cons. Pros. They could be useful to differentiate idiopathic focal segmental glomerulosclerosis (VSG), circulating level of super RA, useful to identify prime kidney disease in patients with nephrotic syndrome secondary to VSGS. Cons. High level of super contribute to a state of inflammation at kidney level. They are considerable deficiency in the precision of sensibility of the diagnosis of these variables. issue a plate in Ecuador. High prevalence of chronic kidney disease is the eighth leading cause of death in the adult population of Ecuador. Prevalence of kidney disease in Latin America is 650 patients per million inhabitants, with an estimated annual increase of 10%. Considering that Ecuador has 162,78844 inhabitants source ANET, it is estimated that by 2015 patients with kinet failure will be 11460. An elevated support level was independently associated with incident chronic kidney disease and accelerated decrease in eGFR in the group study. Thank you.